Well, this week is National Infant Immunization Week, which is meant to highlight the importance of life-saving vaccines. This also comes after a controversial change to the childhood vaccine schedule earlier this year by Health and Human Services Secretary Robert F. Kennedy Jr. Well, the new schedule reduces the number of recommended vaccines from 17 down to 11. However, the American Academy of Pediatrics continues to recommend the former vaccine schedule. The changes have caused a lot of confusion for a lot of parents about what's recommended and when. So for more on this and what parents need to know and what's changed as well, we're joined by Dr. Jodie Guest with Emory University's Rollins School of Public Health. Thanks so much for being with us this morning. So for a lot of parents who may be hearing about the changes, they've heard about the changes, what's the most important thing they should really know and understand right now?
Well, there are two really important things to remember this week. One is vaccines save lives, and they are one of our biggest public health successes we've ever seen. And second, the changes in childhood vaccinations have actually been blocked by a federal judge. So you can still currently get all of the originally recommended and scientifically backed vaccines for your children.
We talked about the number of vaccines being reduced, but what are some of the most common misconceptions that you're hearing from parents and patients right now?
Well, that there was science to change the reason that they wanted to reduce the vaccines, and there is no new science. The science consistently shows us that these vaccines save lives. These are the healthiest things that you can get for your children, and all parents want their children to be healthy. That's our outcome.
Why is it so important, though, for infants especially to stay on schedule with these recommended vaccines?
Yeah, that's a great question. We know that these vaccines work the best when your child receives them before the age of 2 for those that are recommended for that age group. And so their immune system is going to learn the most from the vaccines at that age. And we also know they're most at risk during that time. So it is a win-win to go ahead and follow the schedule.
So are the changes that we talked about something that parents should be concerned about at this point, or more about just the timing and clarification that we're hearing?
Well, again, at the moment, the changes have been blocked by a federal judge, and we're really hopeful that that will continue because, again, these changes were not based on science. And instead, we want parents to recognize how incredibly important these vaccines are and how well studied they have been.
So if a parent has perhaps kind of been waiting to see how this will all play out, if a parent has fallen behind on their child's vaccines, what should they be doing right now if they've fallen behind and maybe want to now move forward?
Right. So now is the perfect time to talk to your clinician about vaccines and make sure that you are understanding which vaccines your child needs. We have about 19 million children in the United States who are under-vaccinated. And so this is the perfect time. This is the week that we want to be talking about how important it is to get all of those children and their parents to a clinician to talk about their vaccine schedule.
You talked about some of the early vaccines and why they're so important. What are some of the diseases and illnesses that these early vaccines help prevent?
Yeah, that's another great question. And so we want to be preventing things like pneumococcal disease, Haemophilus influenza. We want to be DTaP, which is tetanus is the primary one that most people think about that, but also diphtheria. Rotavirus is really important, polio, measles, mumps, and rubella. Many of these diseases, most of us have never seen in our lifetime or known someone that's had it. And that is because these vaccines have saved lives and prevented these illnesses.
And so would you say the best advice right now, if people have questions, is to really consult with their own doctors?
Absolutely. We know that most people trust their clinicians to provide the best guidance for them and their children. And so we really hope that you will speak to them if you have questions about vaccines.
Dr. Guest, thank you so much for joining us this morning. We appreciate your information you provided.
Thank you. Thanks for having me.